What about the life procedure is so special, and am I a candidate? Here we have a typical breast that's coming in for mastopexy, which is a breast lift. In these cases, either the breast is deflated from volume loss or it can be large and require reduction. But the point here is that the breast is hanging low, the nipple is pointing down. And what we want to do is we want to remove skin from below, lift the nipple position up, and redistribute the breast tissue above the line of kind of the middle point of where the breast is. And so this shows you what a breast looks like after a mastopexy. In this case, the nipple is at the most projecting part of the breast. We've really released a lot of the heaviness from below. 60% of the volume of the breast is below the nipple and around 40% is above, or maybe 50-50. So we've rebalanced the breast and changed it from a situation where most of the heaviness was low. We do that by removing skin from below. Now, this is your standard mastopexy. But the problem that I see with the standard mastopexy is that it's really reliant on the skin and the breast tissue on the inside. And over time, this is going to continue to have the same problems that we had before. It can lead to early bottoming out, it can drop. If you put an implant in here to add extra volume, that can accelerate that process. So the life procedure is a more advanced approach. What we're doing is the same approach to the lift. So we're going to be removing breast tissue and skin and lifting the breast up. But then on the inside, what I've drawn here is this internal bra, which is a material that we use on the inside that's essentially made of the same material that the stitches are made of. And we fasten it here to the ribs on the chest wall. So it is attached to the chest wall and it doesn't move. And what it does is it provides support to the breast tissue. If there's an implant, it's very important to help support that implant. But even if it's just breast tissue on the inside, that internal bra is basically creating a support for the breast. And it lasts about 18 months, which is about the amount of time that it takes for the tissue on the inside of the breast to heal. This is great because the body will remodel the internal bra. It'll become collagen, which is like a support network on the inside, at the same rate that it takes for the breast to heal. So that once that healing is complete and all shear forces and all other stretches are done, that bra is gone. Now, the other thing we're doing is we're adding fat. So this is meant to show you where the pectoral muscle is and where the rib cage is. We're going to add fat to this area up here to improve further the sculpture of the breast and the amount of volume that's above versus below. Using fat allows us to address a few key areas, including the décolletage, using nanofat to improve the quality of the skin that's there. So the nanofat has growth factors and stem cells, and that helps that wrinkly, crepey, poor quality skin in the décolletage. The other thing it does is it gives me more volume for the actual cleavage. So I can use it to add volume to the medial portion of the breast and to just sculpt the breast and change the shape a lot more and make it look a lot prettier. And then after I've done the fat transfer and the internal bra and the lift, and this can be with or without implants, then the last stage is something called energy-based tightening. So I like to use radiofrequency microneedling. RF microneedling, which is like Morpheus in our case, allows us to use energy and small needles to change the quality of the skin of the breast itself. So we are relying on the internal bra and the skin quality to hold the breast where it is. So why not use energy at the same time to thicken, improve, and tighten the skin of the entire breast? I want to shrink wrap that breast and lock it in place as long as we can. Putting those needles into the skin triggers more collagen deposition in that skin, similar to the collagen we get from the internal bra. So not only am I going to get thickening and improvement of the skin to improve and the quality of the result over time with the internal bra, I'm also using RF microneedling at a second stage to improve and thicken the quality of that skin, which leads to a better result and perhaps a more durable and longer lasting result. The life procedure is a combination of a lift, an internal bra, fat transfer, and an energy-based tightening. And this is really a state-of-the-art approach to breast surgery. There are surgeons out there that are doing internal bras, that are combining those with fat transfer. This is really the first comprehensive approach to combine standard lifting procedures with internal bra, fat transfer, and energy-based treatments to really completely address all of the issues of breast aging. We do this in abdominal surgery, we do this in facial surgery. I want to do the same in breast surgery. I want to take all of the advances that we have that are great technological advances and combine them to give the most durable and best lasting result. Now, who's a candidate for this type of procedure? Women that are older, that have aged, the breast tissue has lost volume, the skin has lost quality. Weight loss patients are similar because their breast has lost that thickness to the skin, that quality of the skin. And then any woman who's basically had breast drop over time. Younger patients may just need a breast implant and a standard lift and may not necessarily be a candidate, or maybe for some variations of this where we're using just an internal bra or just fat grafting. But I'd say that most patients that are in their middle ages or have lost a lot of weight are going to need this type of procedure to have the best overall result. So that's a life procedure, and I hope that you've enjoyed this little drawing on the whiteboard.